So if you have a headache, then we do fascial maneuvers for the headache. What happens, lots of time we are sitting all the time on our legs. Sometimes we are doing lots of things with our hands. Also when we work out, we usually use our hands and legs, and all the pressure from zone 3 and 2 goes in our head. And there's lots of headaches, sometimes tension headaches, sometimes jaw tension and all. So these maneuvers which I'm showing, try 2 to 3 times in a day along with the breathing. So first thing we do is do a spinal pelvic lock. Pelvic lock is you tighten all the pelvic area, then tighten the navel to the spine. Hold these 2 locks, and then now take your right hand and put it around your temple here, just behind the eye, fingers facing backwards, and with your left hand you have the fingers facing forwards exactly in the same parallel area. Now you press the skull as hard as possible. Trust me, nothing will happen. Like that. So I'm doing this, my head is facing forward, spinal pelvic lock intact. So I'm pressing it, and along with that, without losing the grip of the skin, I'm bringing this, and both my fingers, my hands will be touching like this. So now maintaining this pressure, you hold this spinal pelvic lock intact. Now look up and breathe in through the nose and out through the mouth.
Conditions.
3 times. Now look to the right, inhale through the nose, exhale through the mouth. 1. Inhale, exhale. Inhale one more time. Exhale, maintaining the pressure on the hands and spinal pelvic lock. Now look to the left. Inhale. Exhale 1. Inhale. Exhale 2. Inhale. Exhale 3. Now go down to increase the pressure and then release the tension, and then rotate your head from right to left. Inhale, look up, exhale 3 times. Inhale, exhale, maintaining the pressure, spinal pelvic lock intact. Inhale, exhale, and gently come up, open and close your jaw 3 times. And when you release everything gently.
Good.
I feel a release. Sometimes you can hear a pop in your ear. That just releases the fascia around. So now what happens, all these fascial lines of the body goes and attaches to different parts of the skull. So we are now releasing here because many lines and meridians passes from the ear. So now hold with your left hand, hold the top of the right ear, and with your right hand hold, if you're not wearing an earring, it's better. So hold this area and then press as hard as you can and pull the ear away from the skull. And now tilt the ear horizontal. I'm just showing you from this side. Tilt the ear horizontal and then keep pulling, and now look down as if you're looking up towards the right side. And you keep pulling the ear and the ear horizontal and press with both your hands as hard as you can, as if you're going to pull the ear out of the skull, and then go down. Inhale through the nose, exhale from the mouth. Inhale, exhale 6 times. Inhale, exhale, inhale, exhale 4. Inhale, exhale 5. Inhale, exhale 6. Gently come up. As gently as you went, just come up gradually and then release the ear and see how you feel. You can see, or I feel it, that my right face has relaxed a bit, my right shoulder has relaxed a bit. even the tension around this area has released. So now walk for at least 30 seconds.
So a lot harder.
There's a gallbladder meridian also which comes all the way here. Gallbladder meridian tightens both the sides of the skull at times, sometimes around the knee and around this area in mid back. Now we are going to do left side. Press with your right hand, right fingers, hold the top of the knee, top of the ear, and now this with your left hand, lower bottom of the ear, and now pull the ear and then rotate the ear horizontally, parallel, almost parallel to the ground. I'm going to show you this side so you can see what I'm doing. And then you can look down and then keep pulling the ear, maintaining the horizontal pressure. Inhale through the nose, exhale through the mouth. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. One more time, inhale, exhale, and gently release. So in all the fascial maneuvers, we do the spinal pelvic lock, so we are more stabilized from the center. Otherwise, when we are doing something, the center will go here and there. So the pressure and the energy which we built up goes and dissipates somewhere else. So we have a force bleed. So always spinal pelvic lock intact. Now we are going to do a third maneuver because the tension headaches are also because of the jaw tension. So I'm going to release this. So we are going to do a cheeky fascial maneuver. Getting cheeky with it, okay? So I'm going to pull have my fingers facing, right hand fingers facing backwards around the meaty part, the masseter muscle just around the jaw, and then left side, this side. And we'll be doing only one side in this way because that's how we are, we moderate in our life. So most of our environment is on the right side. And the way it has been researched that we are only mostly using one side more and twisted one side more. So this maneuver, both the antler twist and this, we are going to do this way. So right hand facing backwards around the meaty part, left hand around this, around the cheek meaty part, and then I'm pressing it, and then both the fingers till the elbow comes parallel to each other. And then now inhale through the nose, exhale from the mouth. Inhale, exhale, inhale, exhale. Now tilt your head, squat a bit, inhale, exhale. I'm maintaining the pressure on my hands, spinal pelvic lock intact. Inhale, exhale. One more time, inhale, exhale. Now tilt your head to the left. Inhale, exhale, inhale, exhale, inhale, exhale. Come back. And then open and close your jaw 3 times. Look up. I feel there is a pop, like my eyes are popping, my ears, everything is opening up. And one more fascial maneuver we'll be doing is the hair pull. So you hold the hair in the center here. Sometimes if people are feeling that they don't want to hold on to their hair, then I give a napkin here, and people who do not have hair can use a napkin. So I'm going to rotate, grab hold of my hair here and rotate it where the thumbs will face, my right thumb will face forward. At the same time, I'm going to pull my forehead down. It just helps to release the pressure around the cranial sutures. And I pull it down, and this pulling up and down with your left hand and towards the right. And pull the hair up and rotate towards the right. Okay, so now we are going to do hair pull. Spinal pelvic lock intact. Relax your hands. And now use your right hand. Grab onto the center. Grab the hair. And then now I'm rotating my thumb towards the front. So it will be towards the forward thing. With my left hand, I'm pulling my skull down. And I'm pulling it now this side. So both the hands are going in this direction. So now I'm going to do that. I'm holding up and losing this, holding this. Tighten your spinal pelvic lock always. Go down and tilt on the left hand side. Inhale, exhale. 3 times. Inhale through the nose, out through the mouth. Inhale, exhale, and gently come back and release. And we are going to now do a double ear pull. So you are going to grab the ears, both the ears like that, and I'm going to pull it down because all the time the fascial tension is over the head. If you feel lots of headache and tension here, this works wonders. I have tried it. I've tried all the maneuvers and they are excellent, super powerful. So I'm pressing both my ears, pulling it away from the skull and then pulling it down, and then I'm going to pull up because I want a counter pressure. Spinal pelvic lock intact. Inhale through the nose, exhale through the mouth. Pull the ear down. 3 times. Inhale up, exhale down. Now next 3 times of inhalation and exhalation, I'm going to pull it down, increasing the pressure by squatting. Inhale through the nose, exhale through the mouth. Inhale through the nose, exhale through the mouth. One more time. Gently come back and release your pressure. Tell me how it goes.